Okay, all set. Hi, everyone. This is Kathleen Brown, I'm Chair of the Board of Health for the town of Needham. We're conducting this meeting via Zoom, given the order from the governor from last March 12th, 2020, putting in place a state of emergency for the COVID-19 pandemic. For this meeting, we'll do a voice vote. So I'll call your name. If we need to vote on something, you'll just respond in the affirmative. I'll introduce everyone that's on the agenda or planning to speak. We don't have a public comment, or do we have any public members attending? I don't think, but we're happy to get comments through email, and there's information with the packet that we've received today posted on the website. So I'll just announce the members that are here and then just say yes. Christina Matthews.
Here.
Rob Partridge.
Here.
Steve Epstein. You.
Put on mute here.
So I'll just announce, I guess anybody else is gonna, Tara Gurge.
Here.
Diana.
Here.
Karen.
Here.
Mary.
Here.
Hi, Carol.
Aye.
Aye. And then that's probably it. Anyone else? Oh, DJ Wilson, I guess, is going to attend. Do I need to introduce? Can you just say your name, say hello?
Sure. DJ Wilson, Tobacco Control Director at Mass Municipal Association.
Okay, great. Thank you. And Lynn is here. Hi, Lynn.
Hi.
Hi. Dawn Stiller. Close enough. Okay. Okay. So I'm seeing Christine.
Traveling nails, sorry.
Hi, Marianne. There you are. So,
Hi.
okay.
Okay, thank you. Good evening.
Okay, great. You too. Okay, so we'll start with the first item, which is to look at the meeting minutes. We had 2 rounds of meeting minutes that were posted today or sent to us. Does anyone have any comments on the meeting minutes? Okay.
I think there was just on 224, the meeting schedule that was posted on there. It said March 24th. Isn't it March 26th, our next meeting? Or do I have it wrong? Aren't we March?
Oh, I have 26th on Friday,
Okay.
8 a.m. I don't know. I mean, that's what I have in my phone.
It might actually say that on both minutes, that it's March 24th. So maybe just change that.
Okay. And let's just confirm that time for everybody, right? That's what everyone else has. Yeah, this one's correct on page 4, I guess. So just make that correction of the dates.
Then I think there's one point where it's referring to Karen and it says Mr. Shannon.
Oh, I did see that. Yeah, sorry. Yeah, minor fix it.
Minor. And then one other thing was it was referring to the clinics and it said we had administered vaccine to, I don't know what it meant by this, but it said 7% of minorities. So maybe just clarify what you're trying to say there.
Sorry, which, do you have a page number?
Let me see. I know, sorry. I
Easier
just
for
pulled up a new one. Okay.
If you suggested language, I mean, non-white, I don't know what else. What is there a phrase that we're recommending there?
Yeah, was it actually that high that it was 7%? I was actually not even sure about that, but I couldn't find the chart from last month.
So on page 9 of the packet, it does say 82% white, 6.7% Asian, and smaller Hispanic and Black.
Okay, so that is right.
Is that the line you want to clarify?
Yes, yeah.
And then
I see
further
what you
down
mean.
on the same page, it says, since Needham has so far served approximately 7% of minorities. That could be
Yes.
reworded, I think.
Oh,
Okay.
yeah, so that's
Perhaps something like since so far there, the percentage of people vaccinated has included only X percent of minorities. Is that a way you might want to phrase it?
Sure, yeah. Yeah, I think that would be fine.
May I say something?
Sure.
I don't think, I definitely think that needs to be clarified. But it's not, it shouldn't be 7% of minorities, but 7% of those vaccinated were minorities. Very different.
But I think the number is also not correct, because the percentage of total vaccinations minorities is higher than 7. So we should clarify that too. Okay.
Okay, so we can fix those edits.
We can certainly make those revisions.
Okay. We can just vote to accept with those edits, or do you want to review it again next time? Make sure the numbers are right.
I
Folks.
think we can accept with those.
Okay, all right, so we get a motion to accept the minutes, both sets.
Sure, I'll make a motion.
And I'll second it.
Okay. All those in favor, Steve,
Aye.
Christina,
Aye.
Rob,
Aye.
Kathleen, aye. We still don't have, so we'll accept the minutes from both time periods with those edits. We still don't have Ed here, right? I just wanted to make sure I didn't miss him. Okay. Let's see. So the first item on the agenda is discussion of the tobacco regulations, the state revisions, and then adoption of the, basically we had talked about this previously, but make some more revisions and discuss these changes. Tim, did you have anything to add or lead into that? Or?
No, I think I would leave it to Tara and DJ and Diana to take the lead on this part of the discussion, because they're the ones that did the research and prepared the materials that are in the packet.
Okay, yeah, sorry about that. Thank you.
Yeah, so I think this is the point where we're going to discuss again the revised tobacco revisions that DJ had recommended that we add. And I think the discussion too, we want to finalize the fees and to adopt the state fines. So DJ, and I know Stephen had a question or clarification. Did you still have a question for DJ?
Yes. I mean, I saw the written explanation, but I just want to make sure we kind of have this nailed down. This is in the violation section, DJ. So we have very specific town violations as opposed to the state ones.
Yes.
And in particular, I think there's an interest on the town side of keeping the suspensions in place the way we have them. We're less concerned about the fees. We can't waive the state fees. That's a state penalty, right? But there was this issue of double jeopardy, because we want to make sure that we still keep what we want from the town in place along with the state.
Right. So I provided a paragraph, and I think on page 15 under 2, Tara would have put that paragraph in just to make it clear that you're going to count both kinds of fines towards suspensions.
Right. So, I mean, I don't know if I've got, Tara, do we have the most recent one? I know there have been 3 packets that have gone out today.
The recent ones were in the initial packet, so they should be in there. And we added that same paragraph that DJ recommended on that.
Page 28 of the PDF, if that helps.
Right. Well, I've got page 15 of not the green. We have the green copy, and then we have the yellowed copy. We have 2 copies. So I'm looking at the yellow copy here.
Yep.
Right. Mm-hmm. So we've got both here. Here it seems fine. If that language isn't going to get us into the issue of double jeopardy, I think we're fine.
Yeah, I think as long as you make it clear to retailers and that you're not going to have 2 separate suspensions for 2. I think this works.
Okay.
Great. Okay.
I do have a question, Tara. I see that the rolling paper definition has been added, but is there a policy? Where's the policy?
So I guess that's the question I put both in there because I understand, DJ, you mentioned that we could either ban the rolling papers or we could just do the flavored rolling papers. Is that what you were saying, that we had a
Right.
choice to do?
Yeah.
So I left both in there because I wasn't sure which one the board wanted. So that's another discussion for the board.
And so, just to give a little briefing on this, up until a year and a half ago, cities and towns were forbidden from regulating further rolling papers, which would just be, plain, paper, easy widers that we grew up with. And so that was taken away in the 2018 state law update, that preemption. So cities and towns can go further. And so the two options would be, and so one of the reasons that this is percolated up, that we see hemp wraps showing up on counters in stores, especially hemp flavored wraps, especially this one company called Natty Hemp Wraps. And so, technically, you could argue whether or not they're an enhancer under the new state law, but it gets a little dicey. So we can take advantage of this preemption excision from the state law and do one of two things. You can ban them completely. So that would be even the plain ones would leave any stores, or kind of furthering the public health rationale on flavors that both you did years ago, then you updated dramatically, and then the state law took your lead to just do the flavored ones. So it'd leave plain ones in stores, but all the flavors would go. And so that I think Tara may have included this in there too.
Right.
They're both simple changes to either one, to the policy, just that it was the state law provided no definition for rolling papers. So we did invent one using a bunch of different sources that I found.
I just interject, Ed Cosgrove has joined the meeting. Sorry about the confusion on the time, and just want to note that you're present in case there's.
Thank you.
Just say yes. Okay, thank you. Sorry, go ahead.
I have a question. Do we have any information on plain rolling papers? Are they sort of a large sale item for the stores that have tobacco permits, or? I would imagine that the flavored ones could become that, but the plain ones, are they a big deal?
I don't know. I honestly don't know. So part of another confounding issue to all this is that, rolling paper companies have for years said that it's only used for tobacco, because they couldn't say that it was for marijuana because marijuana was illegal. Now marijuana is legal, so they can actually say it's for both. And this kind of argument, they want to say, oh, it's really for marijuana use, not for tobacco use, because they don't want to implicate us into regulating them. Yeah, but like all the flavored issue is the big issue. And one of the other issues that we are running into, just to let you know, is it's really hard for us to get any sense of even what high school kids are doing these days, because they're not sitting in high school. We have absolutely no idea if kids have stopped vaping because they can't do it in their house, or we have no idea what they're switching to. We have no idea how this is all happening. And so, but we're trying to get ahead of it and just think to ourselves that if they liked, flavored blunt wraps more than plain blunt wraps, they're going to like flavored rolling papers more than plain. But I don't know what the sales numbers are on plain.
And I wanted to add, in Needham, in our tobacco establishments, I don't really see rolling papers. I think if there were to be one, it was probably at the chains, so either 7-Eleven or Speedway. The gas stations have a very limited amount of cigarettes. And the only place I know for a fact that I've seen the rolling papers was at the medical marijuana dispensary. So that's that's outside of this regulation.
It would seem to me that to be consistent with our current regulations on cigarette sales and no flavors and things like that, that we should I would favor the regulating flavored rolling papers, just to keep those out. And I would, with that, say that probably selling plain rolling papers is okay.
Anyone else have questions? Any other board? Hemp's a flavor? Like, I mean, I guess like menthol, but yeah.
It's hard to know. And I should say, the company that I indicated, the manufacturing company has sent letters to half a dozen boards of health across the state saying they've laid out the case for their lawsuit if anybody did it. So, but they did that prior to us all realizing that the preemption was gone for rolling papers. Yeah.
Anyone else have any questions or thoughts? I really don't know what to, yeah, nobody feels like drawing the lawsuit, but.
No, I think the, lack of preemption does that. But, if there were, because I can never rule out that there would be a lawsuit, if there were, it's much easier to argue the flavor part because you already have done that twice and the state agrees with you. So that kind of, it follows the public health rationale.
Yeah.
Madam Chair, if I could, it's now 6:20, which
sorry.
is the official start time for the board's hearing. So it may be valuable to call the hearing to order, and then the board could continue its discussion with DJ.
Okay. Sorry about that. Okay, so we'll call the hearing on the revised tobacco regs, the regulations affecting smoking and the sale and distribution of tobacco products in Needham. Will open now, and we can have additional comments or questions about the revised regulations. So are we going to address these? I think the edits, I don't know how others feel, the edits that are here meet what we had discussed previously, except for this rolling paper issue. Did any other board members have specific questions about, the edits, except for that item, the other edits that have been made? Seems okay.
I'm going to move that we adopt this with the regulate flavored version of the rolling paper as was suggested by Rob.
I second that.
Okay, so we'll do a roll call vote. Christina?
Aye. Yes.
Rob?
Aye.
Ed Cosgrove?
Aye.
Okay. Steve?
Aye.
Kathleen? Aye. Okay. So we'll accept the revisions with the flavored tobacco or the lack of flavored rolling papers in town. Do we, can we close the hearing early, Tim? Or do we need it open till 6:40?
You could close the hearing early. I would suggest leaving it open. There are currently no attendees, and no one from the public has signed in or wishes to comment, but it would be good just to preserve the option for any member of the public that does wish to comment.
Okay, but we can move on to staff reports and things.
Yep, and keep the hearing open, and then you could come back and vote to close the hearing and take a formal vote on the proposed changes.
Go ahead, DJ, you had something to say.
Yeah, so if I could just take 2 minutes and include Tara in the conversation. So Tara, I would have sent you how to do this, and the way it would get done is on the bottom of your flavor policy, which is section G. A sentence I would just say, for this regulation, flavored rolling papers as defined are tobacco product flavor enhancers. So it just captures them in that enhancer.
Enhancer, okay.
Okay.
All right.
I sent that to you in the email, 219 email. Yeah.
And DJ, if I could just ask you one question. I think our regulation actually gets this, but there's some company out there now making a vaping solution with nicotine not derived from tobacco. And they're getting around the federal law that way. From what I can see on our reg here, we're good. We're going to cover that.
We are. And in fact, the state law is more strict on tobacco products because you have to have nicotine or tobacco. On vape, the state law is very permissive. It just says anything to be vaporized or aerosolized. So that's how it captures. So under the state law, what also gets captured is nicotine derived from any other source, CBD, vitamin B12. I mean, these are some of the things that we've heard that people are vaping. So it all gets captured under it. Yeah.
Okay, good. Thank you.
Can I just ask
Yeah.
one question about the regulations that have the green enhancements? There seems to be a few where we haven't actually put in numbers and things like that. I'm specifically referring to on page 8 of the green regulations, like 9A.
So
It's page 8, but it's item 9, the maximum number of tobacco product sales permits.
So that was the original draft that I and Tara were working from, but the one above it is an upgraded version. So that the one with green and yellow is like our sample for boards of health to look at when they first look at it. But the one above it has been refined to include what the board wanted up until this point. Is that right, Tara?
I believe so.
So you would have, it was called that you would keep you haven't changed your capping language that is found in E11 at all. So that's perfectly fine that you didn't change it. But I was just giving you all the options that are available when boards of health look at our sample.
I see. And have we been specific about the issue about adult-only retail stores? And what I'm referring to is if a current tobacco permit holder has a permit and they get bought by an adult-only retail store, would they be able to start business as that adult tobacco product store? Because I was looking in the greened out ones, and it looks like we could regulate that and say the number could be 0 if we wanted to. And I was just wondering if other board members had any thoughts about that.
I can explain that a little further if you'd like.
Yeah.
So a subsection that is available in the sample, and the town of Burlington was the first to do it. So what Burlington has, and I'm going to make up these numbers, but they said, we have 40 tobacco sales permits, but only 3 of those can be held by adult-only retail tobacco stores. And so we probably have about half a dozen cities and towns that have adopted this, and they are all over the place. And some have said 0. We're going to have 0. Maybe Norwood was one of those, but yeah, some say 0. And that would have been found in the green and yellow sample. It's just Tara and I both used yellow, so makes it a little exciting to figure out what we're doing. It'd be page 9, or under subsection C, is a sentence that allows a city or town to take that total and then make a subcategory that says only so many can go up to.
So right now it's left that could occur here based on our.
It's in his example, they could come forward.
Okay.
If in Burlington they were already at the 3, that convenience store to adult only couldn't do it. If they were under the 3, then something.
Okay. Are there any further questions? Okay. Who's up? I guess we are up with emergency management. I don't think Talib's here, so.
Yeah, unfortunately, a lot of the staff are here at the clinic at the center at the Heights. I'm in a back room, but a lot of the staff are here at the clinic.
Right. Great. Okay. Well, we still have tons of volunteers waiting to be called up for duty, I know, but waiting for.
I guess the one question I might ask the board is whether they expect that there's other questions or issues they'd like DJ's expertise on.
Okay.
If there's not, we could potentially, thank him for his time and then move on to the other agenda items.
Okay. Any other board members have questions for DJ? Okay. I guess not. You did such a great job. Thank you.
Thank you.
Thanks for coming.
Thank you.
Thanks,
Thank you,
DJ.
DJ.
Have a good
Thanks,
night.
DJ.
Bye-bye. Hi, Carol.
Hi.
So Talib's report is pretty straightforward, just talking about the total number of MRC volunteers. For those that, I think some of the board members have been through the clinics just to see them already in action. Talib helps to coordinate all the volunteers, get all the staff. He also helps to get our volunteers queried and credentialed and background checked, and helps to arrange some of the online training that they do. So he did a brief report, which is a variety of colors, I guess, about the number of volunteers we have in different stages of the process. It's a significant increase in the total. We still have to move a couple through the final background check or credentialing. And we're looking forward to getting more volunteers in. Volunteers have been crucial, helping to run our vaccination clinics. We've had volunteers from staff from who have volunteered from other town departments, which have been great, including aging services and park and rec, and other health and human services departments. But our MRC volunteers have been really quite critical.
You think we're going to have another vaccination clinic? Are we going to get any more vaccine?
I think that's an open question. We do have a meeting tomorrow, Tiffany and I do, with the Assistant Commissioner from the Mass Department of Public Health to talk about the regional 10-town partnership that we put forward. They in the email to me inviting me to come to the meeting did caution that essentially their biggest criteria is whether you're more than 45 minutes away from a mass vaccination site, and we are, depending on traffic, within 45 minutes of 3 mass vaccination sites. I think the Baker administration also today had a meeting with organized labor and clean teachers unions where it made a very sort of strong statement that it's not going to go out of its way to help teachers get vaccinated, at least not in the way the teachers were hoping for. So I think one of the potentially really preferential aspects about our plan was it would allow the 10 different towns in question to help ensure that critical workers, and I mean that both in the town critical workers, which would be school staff and DPW staff, building commissioner staff, as well as critical workers from within the community, like grocery stores and food service and food sector. It would bring the vaccine closer to them and help enable vaccinations within each of the 10 communities for those groups when they become eligible in the next step of vaccinations. Given the Baker administration's response to the teachers union's request, it seems unlikely they will find that as big a selling point as I thought it was. So that may be a challenge. So
the question is, essentially we're beefing up the MRC, but for what, to what end?
I think that's a fair question.
It's great if the volunteers are perfectly happy standing by, but it seems like a lot of effort's been expended. A lot of people have set aside time to do all of this, and their good intentions are being trampled on by the state. And I don't want to perpetuate that unless we have a purpose for them other than this.
Sure. I do think our primary purpose was we were hoping to do vaccination clinics. We have put some volunteers to work. The Aging Services Division is getting a staggering volume of phone calls. It's down slightly from its peak of about a week and a half ago, but between voicemails and active phone calls, on the order of 150 to 200 a day. Some days as low as 90, but that's still quite a lot of calls and voicemails. So we have been putting some of them to work, helping to respond to those calls. Some of them have joined some of the other sort of aging service focused programs like the Friendly Caller program. But yes, our primary purpose for the Medical Reserve Corps was going to be assisting at vaccination clinics. So I think that it's a fair question. I think if there is definitively no more vaccination clinics, I think it will be hard to attract more volunteers. And I don't think we'll have a ton of work to do for them to do. I will say that the only consistency about the state's vaccination plans has been the inconsistency. So the fact that they're pretty sure they don't want us to vaccinate, I guess almost makes me feel better because they've changed their mind on everything else. Why not this? But
So even if supply increases, it's not going to go, they're not going to expand the outlets, essentially. They're all in on mass vaccination is the point, right?
Well, pressure.
that's everything they've said in public, and it's certainly what a couple people have said to me in private.
Mhm.
I think the only thing we can do is keep putting pressure on them. They seem to respond to pressure sooner or later. And quite frankly, I mean, the way to vaccinate the Needham teachers is the best way is through the Board of Health. Instead of sending them down to Gillette or wherever. That's ridiculous.
I agree. I think, even the Baker administration's plan to set aside some vaccine on weekend days, I don't think allows for schools to manage outages that, especially staff who are feeling ill after the second vaccine. It does not allow them to manage their absences in a way that we did afford to fire chiefs and police chiefs in terms of managing their absences when public
Right.
safety was vaccinated.
Yeah.
And to a lesser extent, I think healthcare institutions also tried to manage a little bit of how they, vaccinated some staff, like emergency department staff. I think they tried to spread it out a little bit, although that was harder in hospital settings, I've heard.
I'm just outraged at the Baker administration's position on this.
Understood.
Okay, so we'll move on to Karen, I guess, substance use prevention.
Good evening, everyone. My report for February really breaks down to a couple of different categories. I'll start with the vaping grant briefly. You may remember from my previous report that we talked about the cessation program and that we are continuing to promote, and we have made a special effort to capture health equity in that promotion by having some of our flyers and materials translated to different languages that are identified through the Needham Public Schools as languages that are needed. Those happen to be Spanish, Portuguese, and Russian. We've also made movement on our vaping education in the wellness curriculum. I'm happy to report that the 6th grade students now have a vaping unit in their wellness curriculum, and that was administered to them a couple of weeks ago over a period of 2 weeks. It's an online set of educational videos, including a pre and post test. So we're happy to see that those videos that we had recommended have been implemented. And the 9th grade wellness classes will be implementing an online vaping unit called Vaping Knowing the Truth, which is part of EverFi's online modules. We already use the alcohol EDU program for our 9th grade students, and now the vaping unit will be implemented as well. So we're pleased to report that. We also submitted our mid-year report to the Metro West Health Foundation last month, so everything's on time in that regard. And then just briefly, we had an event last month that drew 170 people one evening on February 11th. It was a presentation by Dr. Jill Walsh, and it was called Navigating Screen Time, Digital Socializing and Parenting During COVID-19. We hosted that event in conjunction with the Pollard Middle School PTC and Beth Israel, Deaconess Needham. So we clearly saw that was a touch point for people that were really interested in the mental health aspects of their children's screen time use. We had actually 300 people register, but 170 showed. And
I
then
just watched it the next day, because you left the recording. Is excellent for parents. Really good.
Yes.
Thank you. So
Thank you. Yes, that recording's been made available, so we're happy to share that broadly. And then Just briefly, one other thing I wanted to touch upon, that we have made our youth development training a focus this year. And so I'm pleased to report we sent 2 students to a 4-day leadership forum through CADCA, which normally is held in person in Washington, DC. This year, obviously, it was virtual, and they attended remotely for 4 days, and that included a number of training sessions and visits with state legislators' offices, including Senator Ed Markey and Representative Jake Auchincloss's office. So that was really inspiring to see those students really grab onto that. And that's part of our public health department's commitment to developing prevention skills in our high school youth. So we're pleased to report that. Those are sort of the highlights. Happy to answer any questions.
Any board members have questions? All right, we'll move on to, I guess, Carol.
If I could
Sure. Oh, should I?
interject, here, about 20 seconds to 6:40. If the board wanted to officially vote to close the hearing and then take a vote on the amended language as the board wanted the amendments included, that would allow us to formally adopt the revised tobacco regulation.
Okay. I thought we voted, but did we vote too early? Sorry.
You did vote too early. That's okay.
Sorry. Can't trust me to run a meeting. Sorry. Okay, so we'll take another motion to accept the revised tobacco regulations and close it. Do I need a second motion to close the hearing? Sorry.
Yes, you want to close the hearing first.
So let's close the hearing. Okay, can I have a motion to close the hearing?
So moved.
Okay, second.
Again,
Okay. All those in favor, Steve,
Yes.
Rob,
Yes.
Ed,
Yes.
Christina,
yes.
and Kathleen, yes. So now we will vote to accept the revised regulations. Can I get a motion for that, including the revisions discussed tonight, the flavored rolling papers?
So moved.
Second.
I'll do a roll call. Christina,
Yes.
Rob,
Yes.
Steve,
Yes.
Ed.
Yes.
Okay, and Kathleen, yes. So, okay, that order of business sorted. Is Carol, oh, there you are, Carol, you are here. Any highlights?
I submitted my report, but I'll say I've felt privileged because I spoke to my grant manager and DPH through BSAS, and I've been able to help Tiffany and Tim and do some work and attended clinics. And Kathleen, we registered many people for second appointments. You all know, I live in Medfield. We have no capacity, and I've been really moved to see what Tim and Tiffany have put together. And I feel exactly how Ed feels. And I expressed that to Denise, and I know I'm going off topic, and I always do, but it was really inspiring. And I got to work the other day, the second clinic, and it was really smooth, and people were just so grateful. And so anyway, I've been helping with Gift of Warmth and doing some town staff COVID exposure guidance and just keeping the grant compliance. But it's been a pleasure and a privilege to help out in any way I can.
Great, thank you.
Thank
Mary
you
Ann?
for helping.
Yeah, that's great. So, Mary Ann, we have your report. I don't know if there's any updates or highlights you want to make. We're not hearing you. I don't know if you're talking. Okay. Looks like cases are still down, or cases, oh, so used to that. Meals are a little bit down, so we're flat. So we'll move on to environmental health, to Tara and Diana.
Thank you. Good evening, everybody. I'll give a few highlights here. So basically, we have made the decision to go for that FDA public health intern. We're going to be posting that it will be a paid intern position, and that individual will work with us on inspecting the farmers market when it opens up this season. So that will be exciting, and we'll probably post that in April. We're looking to send it to HR at the end of this month and have it post through April, maybe extend the posting on that to get a good pool of students, and then we could hire in May. That's the goal. So that will be that. The other things going on is that we've been getting some outdoor seating requests. Again, they go through the select board. We are in an email loop on that through which every department comments. So it goes to select board, then from there to health, building, and fire, and we make comments on that. So those are gearing up again now that the warm weather is kind of here this week. So we'll continue to be involved with that and still maintain the COVID protocols for the state on those. Terry from IT is still working with Diana and I and getting the online permits up and running. And so now our newest one we're getting up there is the well permit application. And in conjunction with that, I've actually been working with Lynn on updating our well permit regulations, which literally we stopped doing when COVID hit last year. So we've been gearing up and getting those updated again so that we can make sure that the most updated regs are put in place finally. These are long overdue. So we want to put those up there, and then we can also tweak the application as we amend the regs. So that's good timing there. Housing and septic are still ongoing, keeping us very busy. Diana will fill you in more on the housing and septic side. I can give you one update that we're going to be heading out to the 169 St. Mary Street location tomorrow with select board and building. And so health, all three of our departments are going to be going out there to meet with the owner and talk about the ongoing, this has been another ongoing concern we've had with the exterior items. The builder at 161 has been in touch with Diana and I on some concerns with the amount of items being stored. So we're, again, meeting with the owner on that issue. I don't know if Diana, you want to go ahead and fill in about the housing ones you've been dealing with and the COVID.
Yeah, so housing has been ramping up. So we have just a bunch of different issues. So like one is complaining about bed bugs. So it's just been a lot of back and forth with the tenant and the landlord just getting the services together. I will be going out to that house tomorrow to make sure that the pest control company actually enters the building and making sure, seeing what's going on. We have some in the housing authority as well. Just different things like I did an inspection, tenants not happy with the state of the unit. So a lot of back and forth, talking to lawyers as well. So I think now, since people are home a lot more, these types of issues have been coming up, and different complaints from some apartment buildings with the state of the cleanliness. So everyone has a different standard as well. They might not see that the staff are vacuuming, cleaning as often as they would like. So we're getting those types of complaints. What was the next thing? Now looking at warm weather, we were trying to see if the state has released anything for the pool guidance. Right now, CDC released in February, on February 1st, new pool guidance. So we will adjust to whatever the state has updated. Right now, anyone who has spoken or asked me any questions about the pools in the summertime, right now I've just been giving them the advice that we're just going to follow the same protocols and guidance that was set forth from last year, just because we don't have anything new from the state. I'm sure it'll come a little closer to the summertime. The other thing is this week I sent out, with the help of Tiffany and Cindy, they sent new signage. So it was signage that's posted, I believe, at the clinics about people who are fully vaccinated. So we started getting complaints from businesses like restaurants that people were coming in without masks, saying that they're fully vaccinated so that they didn't have to wear masks anymore. Because I think with the CDC coming out with that advice this week about people being able to be in their homes without a mask if people are fully vaccinated, now they're taking that and thinking like, oh, I can go anywhere without a mask now. So it's just a sign saying I'm vaccinated, what's next? Basically just encouraging the residents, continue social distancing, continue washing your hands, continue wearing masks as well. And in VPC, we're getting alerted. I think we've spoken about this before, about the tent permits. So this week I had 2 private events come up that we get notified on the website. So then I send them the latest guidance on outdoor events. So people are aware that even though it's happening in a private home, they are still limited to 25 people as of right now. That might change when March 22nd, I believe, is the date that phase 4 might go into effect. But if that, once that changes, then I'll change what I'm telling people as well. And another thing is we had our first body art inquiry that actually went further. That I feel like usually with body art, once we give them the fees of the permits, they usually back off, or when I tell them the education requirements, they usually can't show it. But this time I have someone who is showing that they have a technician with training, at least 2 years of training. So now we're trying to navigate with the board of cosmetology on how to move forward to make sure that we're checking all the boxes that we have, since this hasn't happened before. So the salon wants to add permanent makeup. So they're doing the microblading. So just drawing on eyebrows, basically permanent makeup. So she's interested in moving forward. So right now I sent her, Tara helped me today. We sent her documents that the board of cosmetology said she would need to fill out as a renovation form, just because she's changing the designation. It's one of her offices right now. She wanted to switch it over to the room that they're going to make for the technician, just to do solely the service in that room to do the microblading. So that's in process now. So I'll give you guys updates as that continues, but we're just waiting to hear back, getting floor plans and everything, and we'll figure out inspections when it comes. But this one seems like it's moved the furthest I've ever seen.
Any board members have questions for any of this? Okay, have we never done a body art license before? Oh.
No, this would be our first. I mean,
books?
we've, like
Okay.
Diana said, we've gotten a lot of applications. They would go through our regs and then decide they. This is the first one.
Okay, interesting. Okay.
I think that's big. I don't think there's
it's an
anything big.
interesting thing. This microplaning, it does involve actually cutting the skin.
So it's microblading, inserting pigment into the eyebrows area.
Yeah.
Right,
So-
but
So,
it-
yeah,
And it does, it cuts. They had used like a very
It's
sharp.
like a tattoo. Yeah, it's almost like a tattoo.
yeah, that's why I'm surprised that the Board of Cosmetology said you don't need, variance or anything like that. Although maybe a variance is different than a permit or a license, because if you're cutting skin, I mean, you have an infection risk right there.
Right. And we've been going back and forth with the owner of the salon too, and we're hearing, I don't know if the board is getting easier on that type of service, because I know that's a more popular service. It seems like they're being more open to allowing that to happen. I know it's been happening, especially in Boston. There's a lot of those types of places popping up now.
Yeah, their main requirement is to have a separate room, completely separate from the salon. And that's what this individual says she has. And that's what we're waiting to get the layout plans and the approval from the cosmetology board that that's appropriate, that she can have it in that space. So that's where we're at right now. So we'll see if she gets through that piece. So.
Sounds like we have a few other steps after that too.
Yeah.
Okay.
Yep. And then septic, like Tara said, is picking up a lot. I don't think we ever had this much septic, but again, I think it's a factor of people are home a lot, and then there's a lot of people selling their homes as well. So they have to go through that process.
Diana, can I ask a quick question? You had mentioned that we've had a lot of folks or several establishments apply to do body art, but haven't after they looked at our regs. What in our regs has inhibited folks from doing so?
So I know the biggest one was just proving that they have like enough experience doing it. They have to show that they have at least 2 years experience, either apprenticing somewhere else. But I think the major thing, the hurdle before was just the pure cost of the permit itself. Because I think prior to COVID, before we reduced our fees, it was like $700 for the establishment and then $500 a year per practitioner. Whereas something like Body Works, it's $100 for the establishment, $50 for the practitioner annually with our old fees. Now everything's been reduced.
That's interesting. Okay. Can I ask a question on the outdoor dining? I mean, it's been pretty transformative for the downtown. Is there any, I don't know what regulations are being, I mean, I know food safety is obviously still being, you know, what would need to change in order to make some of these things more permanent? Does anybody, I mean, maybe it's a planning board thing, but it's like we're implementing all of our public health regulations generally, right?
Because for us, we're not really blocking, it's just making sure that we get the layout. So we're working in conjunction with fire, police, and building to make sure it meets their regulations. But for us, safety-wise, we discuss like how to serve the food as well. I mean, they're going to thing that they usually follow inside. The biggest thing now is just making sure that they're doing spacing. So I like have gone to different places. It was more last year, not this year just yet, but last year going and measuring like the back of the chair. I try to pull out the chairs too, because I know some people try to get away with like the chairs pushed in and they just are 6 feet apart. But I'm like, if there's a body here, you're not 6 feet apart anymore. But like, for example, the one that we recently got, the restaurant was proposing a 200 square foot area in the back, but then they wanted 8 tables. So that's something that I would have to work with them. Like 8 tables are not going to fit with the requirement that you still have to have the group 6 feet apart. So we just have to work with them on that piece. It's mostly spacing for us, I feel like.
Right, okay.
And building and fire is like the barriers.
Yeah,
Yeah.
building, fire, a lot of issues with width of sidewalks and handicap accessibility, a lot of issues with the police chief and the fire chief were, and I think they've relaxed somewhat on this, but we're very concerned about vehicular. Basically, they wanted a incredibly strong concrete barrier between any cars and any people. Some communities have gone with like flex posts or just sort of cones or something. And I think Needham has relaxed it somewhat, but was working from a pretty high bar of we wanted to have a really defined and strong barrier between the vehicle's path and anyone who was seating on a sidewalk or a parklet or that sort of thing.
Yeah, especially at the places, so like on Chapel Street that they made that area in that parking lot, they really wanted the Jersey barriers there because those little flex posts wouldn't help in any, and there's plenty of cars going through there. So it was definitely, they were very adamant about that. And then if there's tents, the fire department was just concerned about the flammability of the tent itself.
Yeah.
Right.
No, absolutely on the Jersey barriers.
Yeah, particularly that parking lot or anything near the road. I mean, that you can really get up some speed in that parking lot. So that would be very dangerous. Yeah.
I think the last meeting they were trying to discuss trying to make the barriers look a little nicer, just aesthetically. That was what they were talking about. I don't know how it's going to actually happen, but I know they were interested in that.
Yeah, Newton has a painting, artistic group or something that's doing some stuff for the summer. Okay, great. Thanks. Didn't mean to derail it. So next we have Tiffany's update. Oh, outdoor pool. Oh no, it's outdoor pool, right? Sorry guys, go up to the agenda.
I think we had camp technically, although Tiffany isn't here. I think her concern was just to mention to the board that we're getting a number of inquiries from camps that operate. The state has not put out revised guidance and sort of similar to, I think, what Diana mentioned, there's a question about whether it will mirror exactly what was in place last year, whether it will be more detailed and potentially more relaxed restrictions. So I think Tiffany just wanted to make the board aware that, we're going to have to sort of, if we don't get much information from the state soon, we're going to have to go in with sort of the plan of it will be the same as last year and then revise when more information is available.
Okay.
Yeah, those regs from the state or from us?
State.
All right, so we don't, because if we had flexibility, I mean, we could revise them, but we know, because we know more now, but if it's the state issue, then that's going to be up to them.
Yeah, I think the concern would be if we make it more relaxed and the state doesn't make it quite as relaxed in some instances, that'll be the challenge.
Right.
I do want to point out, Madam Chair, that Marianne, I believe, has her hand raised.
Oh, sorry. Hi, Marianne.
I apologize. I left the room for a moment, and by the time I came back, I was off. So I did hear you. Can you hear me?
Yes.
Yeah. Yes. Okay. Yes, the numbers are down, but we're down for February. They're up again for March. It's just the nature of the program. Nothing I could do about that. So we're moving forward for hiring summer staff. So everything is on track. That's it. So I apologize again and thank you.
Okay, great. Thanks. Sorry we went past you too fast. Okay, great. Outdoor pool. We talked about outdoor pool. Did we already?
Yes, that was, I didn't mean to overdo it, but yeah, basically that we're still waiting for the state and we have CDC pool guidance if we want to adjust anything for right now. But
Yeah.
I think it'll probably come out closer to April, May, if anything.
Okay. Is the CDC guidance in it much different than it was the old
It's
guidance?
pretty much the same. That I looked through it and yeah, so I mean, and it sounds like Park and Rec will follow whatever guidance and they might even adhere to last year's if it doesn't come out in time. Like, so they seem to be on the same page with us on that.
I think it ran pretty smoothly last year, so they already have the practice of last year anyway. But they did reach out. I think it was in February. She was already asking us for guidance, but we're waiting for the state.
Park and Rec board, the Park and Rec commissioners are pretty eager. They've called Stacy a number of times, and they've actually called me once or twice. And I think we can't sort of fully predict exactly how things are going to go. But I said what I thought a safe rule of thumb was to assume that it will be like last summer. And if there's a chance it's slightly more relaxed or that we can be more accommodating in some areas, that might be the case. But I would, like a safe plan would be to plan for the same restrictions in place as last summer. And then if it turns out to be a little bit better, then that's a bonus. And I think that's how we're sort of approaching pools and camps generally until we get more information.
It'll definitely be easier to start out strict and then ease up from there rather than going the other way around.
Absolutely.
Okay, great. So I guess next we have an update on the COVID numbers.
Sure. So this was unfortunately one of the late packets. The second packet contained some of the minutes. This packet contained 2 additional slides, which I hesitated to send because it was the third time the packet was sent out, but I thought it was helpful information about symptomatic versus asymptomatic cases. Yeah. I am on a hotspot and I'm the host of the meeting, so I'm not going to actually try to screen share because I've been having some choppy video a couple times. But I did want to sort of walk through it. Hannah Whitehead, our epidemiologist, prepared these slides, and we've tried to take into account what the board has been interested in the past. I don't know if the board wants to walk through each of the slides in turn or just wants to ask questions. I will draw your attention to, and it's let's see, page 76 and 77 in your packet are slides we definitely haven't seen before, which is February symptomatic versus asymptomatic cases across the different age brackets. And I will point out that there are a number of areas where the answer is unknown, and that's essentially due to between the cases we've gotten and the cases the Community Tracing Collaborative have gotten, there was no note about whether it was asymptomatic or symptomatic. So that's where the unknown number comes from. But I did think it was somewhat helpful for the board to see the breakdown by ages, and this is just in the month of February.
Have we ever looked at that earlier at other time periods?
It's not a simple thing to pull together, so we haven't had time. And Hannah didn't actually think she was going to be able to get this together for another week, but she was able to. But I thought it was helpful because the board has been interested in this in the past. Certainly, school staff have been interested in this in the past. The select board has been interested in this in the past. And again, I think the numbers we. Oh, sorry. Go ahead.
No, go ahead. That's good. Thank you.
I think because there are so many unknowns, I think we do have to take it with a little bit of a grain of salt, right? Like are these the exact numbers, given that we have the unknowns? I think we know that they're not. Those should be in either the symptomatic or asymptomatic category. I think it does give us a ballpark understanding, though. And I think it's potentially, maybe it's not surprising, but the fewest asymptomatic cases are in the older age brackets, right? You're more likely to have an asymptomatic case in the younger age brackets. But at least during the month of February, there were more symptomatic cases than asymptomatic cases by a good amount in the 5 to 18 age bracket.
So Tim, how much of that is just due to testing?
I think it's a little bit closer in the daycare.
I mean, the symptomatics obviously are more. The symptomatics are obviously more likely to get tested than the asymptomatics. So
absolutely,
how does that affect these
numbers? Asymptomatics are mostly only getting tested if they've been identified as a close contact or they have a travel history or some other reason. So I think there's obviously a sort of an inherent bias built into that calculation, for lack of a better word. So I think, if you were, what is the true percentage? I'm not sure if we know the answer to that. I would imagine it would be closer to equal. Right now, it seems like it's quite, in the youth age brackets, it's quite heavily slanted towards symptomatic cases versus asymptomatic. And if we're maybe adjusting for your point, which is a very valid one, maybe those numbers come a lot closer together and maybe they're equal or something. I don't know what it would be exactly, but.
The information on the second, oh, go ahead, Steve.
I was going to say the only way to maybe estimate that would be to just look at the close contacts that are tested, right? Because then you have, kind of a randomization of that. Because so you're only, if they're symptomatic, but they were identified as close contacts, then you throw them in the category. If they weren't identified as close contacts, you wouldn't necessarily throw them in. That might get to a truer number, but yeah, it's just there's a bias, and we just don't know how big that bias is. We don't know if it's small or if it's huge.
Yes.
Okay. It's a little bit difficult to know how to interpret the second slide. Percent of cases that are asymptomatic. So in the 19 to 34 year group, it says 100% are symptomatic, but then if you look at the previous slide, there were twice as many that were unknown. So.
I think we're going to have to work on that a little bit. Yep.
Yeah.
I do think she's mining basically the comments part of the Maven data set. So it's not, I don't think it's a clear, right? It's not like there's a variable in there that says symptomatic or asymptomatic. So it's a little bit.
Yeah, that second slide could be seen as a little bit misleading. The first slide is really quite good because that gives us the actual data, and it's pretty easy to read.
Sure. And I think, this is an iterative process. I think I've been pretty happy with the data we've been getting and how we've been able to provide both the board and the community at large with additional data, more granular data. But it's still a work in progress, and there's absolutely some ways we can improve. I think tweaking that slide is absolutely one of the things, but I did want the department to be responsive because I know the board has had questions for a while about symptomatic versus asymptomatic cases. So yes, it's not easy because it's not a report that is easily run like in Maven, but we were able to, with Hannah's time, work to get a lot of that information. Mary,
it is very helpful information. Agreed.
Yeah, I did want to note that Mary has her hand raised, I believe.
Oh. I just wanted to address what Kathleen said. The report that Hannah was able to find, I was actually working with her when she discovered it, was there is actually a drop-down menu that says symptomatic, asymptomatic in Maven. So her data mining was for whenever that wasn't filled out, then she would have to go and mine through the comments, but she was actually able to find a new report that would populate that particular option in Maven.
And how long, when would that be recorded? How long, and it's when they get their test done and when the contact tracer calls them. Do you know what I mean? How many?
The drop menu I believe she's using is that whether or not they were symptomatic at the initial interview. Mm-hmm. And then there's another option in a different page that says, just flat out, did the case have symptoms? Mm-hmm. So it populates in two different places. And then that's where the mining came from, where she would have to go and verify where that was.
Yeah. Okay. That's interesting.
So is that getting at the distinction between asymptomatic versus pre-symptomatic or?
That's kind of what I was thinking.
Okay,
Yeah.
sure, okay.
And I'm hearing reports from colleges that are screening a lot, that they're seeing more symptomatic cases this semester, according to them. And they were screening all last semester too. So it's not, so, you know, there is, and people, as they say, popping later than previously in their experience. But, you know, it's a couple of schools, so I'm not gonna make public policy based on it, but.
Do you know if they're doing subtyping, Kathleen?
Yeah, no, they're not. I mean, they're not doing that, but it is something we thought about, like the variants, you know.
Okay.
So any other questions? Is it good? This is a nice summary. I like the graphics and the vaccination stuff. Any other board members have questions or want to walk through anything specific in here?
I was just looking at the clusters. I was kind of surprised to see that the sports was 0. Does that just include kind of town leagues or these club sports as well?
I think we've got Mary here and I'll ask her to respond to that one.
Yeah, so what the definition of a cluster is when there's 2 positive cases based on a mutual exposure. So we haven't had 2 people test positive based on a sports exposure. And so we haven't been able to classify any of those as technically clusters. We've had to quarantine entire teams, but we haven't had any actually become a sports cluster in this time frame.
So there was one
Month of
case for,
February, right? Sorry, this is just for the month of February.
yes.
Okay, sorry, go ahead.
But just Mary, to clarify, so we've had a case of someone on a hockey team or a basketball team or some sports team that has had COVID, and we've had to quarantine all or a significant portion of their teammates, but then we have not gotten any additional, like none of those teammates came back positive when they had tests done.
Correct. So a cluster is when there are 2 confirmed positives based on a mutual exposure. So if all of us were in one room, one of us was sick and 2 other people turned positive, then it would become a cluster. If just we were all exposed, all went and tested and came up negative, it's not a cluster.
If one person came up
Right.
positive, not
Then
a
it would
cluster.
also not be a cluster. It has to be at least 2.
Okay.
Are we seeing a slight increase in the number of daycare clusters? This seems to be a higher number than last month.
There was, yes, I wouldn't necessarily call it a slight increase. We did have there was a significant uptick in daycare clusters. And also there was outside of Needham, in a neighboring town, there was a very large outbreak at a daycare that did have a number of Needham residents involved.
So if I recall last month when we saw that, there were just, there are just so few kids anyway that, even a couple of kids at that age group is going to skew all the numbers. But that's not what you're saying now. I mean, we're actually seeing, real outbreaks at this point.
Yeah, there were 6 different documented clusters that I had go across my desk in terms of different facilities. Mm-hmm. And one of them was significant, in the dozens.
So any of the family members get sick or just the kids?
There was household transmission in some of those cases, yes.
So does that wind up going into the household clusters as well then? I mean, in terms of the counting, or you don't double count them?
Kathleen Brown at the state DPH. So, or maybe, so I always get confused as to which Kathleen Brown I see.
I think she's Catherine.
Catherine, but I've heard her in the DPH call say that there's, they do end up kind of being counted both ways. But that's their distinction rather than ours.
Got it. Okay.
Okay.
And then after the clusters, there is data on vaccinations, which again is a moving target because we have done some vaccinations in March, including a large clinic on Tuesday and a large clinic that's in progress today. But you can see, what we've been able to do so far in terms of doses administered, the sort of range of communities in which they've come from, the very high range of communities and come from, the vaccination breakdown by age groups and gender and race or ethnicity.
Yeah, all of that will definitely be worth sharing with the state when you go for the regional.
Yeah. Absolutely.
But, I still don't know how we're going to get, household bound people to Gillette to get vaccinated.
Yeah.
I actually had sent an email off to Tiffany. I'm sure she's just been too busy to respond. I have a colleague whose mother is housebound, a Needham resident, and was wondering, what are the mechanisms for her to get vaccinated? And I didn't have an answer, and I don't know that we have an answer.
Yeah, I have a question because I have an email from a person in town as well. I've shared it with Tim in the past, but he just sent me another one.
So I think the challenge right now is there's a state system that was announced recently. There has been no vaccine, at least sent to any communities I know yet, to actually help do the vaccination of homebound individuals. The state criteria are quite strict, So if you're working as part of the state program, there would be many people would not make the cut as truly homebound. I think if we had vaccine on our own, I'd love to figure out ways to try to bring the vaccine as close as possible to the people who need it, especially those with, who are homebound or have limited mobility, or, maybe getting out they're not truly homebound, but getting out is a challenge. Without vaccine, it's kind of a moot point. Right now, their best option is to wait until the state has a program and hope they qualify for it, or to figure out how to get to one of the mass vaccination sites, which is not a good or satisfactory answer for anybody, but it's the only answer we have at this point, unfortunately.
Will the J&J vaccine make it easier to do homebound? Because it's not 6 doses in a vial, right? It's just one. Is that the case? Because one of the problems is the logistics, right? You crack this, puncture this vial, you got to have all your people lined up. You need 2 people, need to be at every house for half an hour. I mean, it is a logistical difficulty. So that's why you could see it happening more readily in urban areas where people are closer together. So anyway, it's something to think about, trying to get those at least may make it easier. So.
I mean, I think 3 months from now, we're going to have the opposite problem. There's going to be plenty of vaccine, and we're going to be begging people to actually get their shots.
Yeah.
But that's 3 months from now.
Yeah, it's shifting though. People are already more accepting. It's, and they can't get an appointment, so that's good. Are there any other issues anyone wanted to discuss or bring up?
I did want to bring up just the school phase-in, because we've just provided no guidance, and I don't know what our communication is like, but I still want to invite somebody from the school committee to come to our meeting and vice versa. I listened in on the school committee meeting, I think it was a week ago, Monday or Tuesday. All the public comments from the parents were, we need to get the kids back in school. We need to get the kids back in school. And, now there's a state mandate, obviously. And, I think we could provide some guidance to phase this in relatively quickly. And I shared this with a couple of people. It's hard to do, obviously, because there are 5 of us. But the idea would be, K through 5 makes sense because we know 5th grade is about the age group where transmission picks up. So you do 3 groups. You do K through 5, you do 6 through 8, and then you do the high school. You do them 3 weeks apart, so you kind of test each phase and you see if transmission goes up, because we should know that within 3 weeks, which is the same way that we reopened the state for the phases. If we were to do something like that and everything worked, you'd have all the kids back in school in 6 weeks. That's, and that's kind of keeping with what the state is trying to do anyway. I mean, I think I don't know what, if they said K through 8 on, April 5th or something like that. But I know they wanted to certainly have it by the end of the month. I don't know if they offered some guidance.
So I think it's K through 5 by then, right?
K through 5 by April 5th, and then by April 26th, middle schoolers, right? So it does
Right.
seem like a kind of 3
It's
week.
already happening that way.
Mhm.
Yeah. Mhm.
Yeah, and the Tulane study provides some guidance just in terms of is this okay in terms of community spread. Right now we're in a good zone for that. I think Tim, remind me, we're still at like 24 per 100,000 for our local hospitalization rate, something like that.
Yeah, it's come down quite a bit.
Yeah, and as long as you're under 36, you're kind of in the green zone, and 36 to 44 is kind of, yellow, and beyond that, they really just don't know. They said the data was too inconclusive, but, that's kind of your caution level. And then it's really just, making sure that the teachers can get the vaccine. I mean, that's kind of key. One thing that I was thinking about, and I don't know if we want to support something like this, is until we can get the teachers vaccinated, does it make sense for us to support the idea of providing them with N95s? And N95s have been a touchy subject. As a healthcare worker, believe me, we don't have enough of them. But what we don't seem to have enough of, at least if you believe the reports, is we don't have enough of the 3M ones that have been test fitted to all of the hospital employees. But last year, a number of manufacturers started making N95s, and there are supposedly millions of these things sitting on shelves in warehouses that aren't being fit tested, but are there, that are actually FDA approved. And if we really can't provide the spacing that would be ideal, and I looked at, we can talk about the Lancet study that forms the basis of all that. Does it make sense, should we try to procure some of those N95s that aren't going to hospitals and at least offer them? Doesn't mean that people are going to use them, but does it make sense to offer them until they're fully vaccinated? Because that's the protection level that we use, in the hospital when we're around people with COVID. And, in close quarters, that might be something that that we're going to see. We don't know. So
I think it's worth a discussion. I know the schools don't have a respiratory protection program. So, what are the barriers to setting that up? Would there be the ability to waive fit testing requirements? I think would be some of the questions, but it certainly would provide an additional level of protection if they're properly fit tested.
Or KN95. I mean, it's still better than the, cloth mask you made out of the t-shirt. I mean, so, but honestly, the surgical mask tied and tucked is, 75% effective in the leak tests that they did too. So, as I say, a well-fitting, mask is very beneficial. But those exist somewhere. This supply is sitting somewhere that you know of, or?
I mean, if there's interest, Ali Raja, who's at Mass General, has been working pretty hard on procuring them for the medical community. And what I understand, I know him, but what I understand he's run into is that hospitals won't accept them because then you'd have to refit test everybody.
Yeah.
And for hospital workers, yes, they have to be fit tested. That's an OSHA requirement. We're kind of in uncharted territory when it comes to the teachers. And I agree, a well-fitting mask is kind of the key here. The N95s tend to fit well. They're probably better than cloth masks, but I don't know what type of respiratory protection the schools are even talking about for teachers, if anything. I mean, even if we could get them just regular surgical masks, right? I mean, that might be an improvement from what they have right now. But does it make sense for us, to do something like that? Or to at least suggest that to the school committee? Because
I like that idea. I mean, I think it offers our support, at a time when they are pretty frustrated and worried about getting back in schools with, 17 kids right now. And we don't know, it could go up to 22, 23, 24 in another 3 weeks. And it feels as I think so many of us feel very helpless in this situation, that we haven't been able to provide vaccine to our own community. That I like the idea of doing something like this. I think the N95s would be pretty tough for a teacher to wear all day. I think, my daughter was in kindergarten. I think even with a KN95, sometimes it's tough for her to make out what I'm saying exactly if we're in, a grocery store or something like that. But but at least we can offer this. You know, I don't know what our funding situation is to provide masks, like, you know, do we have funds available for this?
As I understand it, Finance Committee is not going to support a warrant article at this year's town meeting for the current fiscal year. So I don't know about the rest of the town budget. I can tell you there's not money in the public health budget to purchase masks for all the teachers and school staff. There are about 900 school staff in total. That's not all teachers. Some of them are aides, assistants, clerical staff, front office.
Right. I think we're talking about, you know, front
nutrition.
facing who are going to be, you know, in a potentially crowded classroom. I mean, right now, you know, K through 2.
Yeah, and I don't know what subset of the 900 that is.
Right.
Yeah, and custodians, like people who are interfacing with people. But you also have like kitchen, you know, food service. You know, it quickly expands.
But to some degree, I'm thinking, you know, as a board, you know, it's our job to say, look, you know, there is a path, there may be a path here to opening safely. Here's what it's going to take. I don't think it's necessarily our job to figure out the logistics of making that happen. For instance, you know, being creative with school space is one of those things they're going to have to do once they start, you know, opening up, you know, Pollard in the high school and all of that. We're not going to tell them how to use their space, but we could say that, you know, look, you know, this 3 to 6 foot, you know, guideline, it makes sense to stay close to 6. And it makes sense because if you look at that Lancet article, there was a meta-analysis of 44 studies, only 7 of them were dealing with COVID-19. It's already getting old, it's from June, so it's not taking into account the variants. So it's really based on MERS and the original SARS, which, you know, not nearly as contagious as COVID-19, although far more deadly. So that's where that 3-foot guideline came from the WHO, and it was the best stuff that we had back in June. But, you know, I don't know that we find that that's so relevant with variants coming up. And all of this, of course, is coming at the same time that, you know, the community rate's going down, the vaccination rate's going up. So, you know, it's a delicate balance here. But I think that, you know, we could say, look, you know, we think you ought to try to get this spacing. You ought to offer masks. I don't think we have to say how you do it.
I don't think I mean, the spacing is a question. There was a paper that came out yesterday, right? That saw no difference. I wouldn't hang my hat on this paper, but they did study all of the school districts in Massachusetts. So it's, you know, it's compelling somewhat. It's a very simplified analysis. But so I think, yeah, good masking in the interim while people are getting vaccinated, get the kids back in. I would support some guidance on good mask fitting practices, you know, and if we can get N90 or KN95s, I don't think we should be fit testing teachers. And I think they're very hard to wear today. And then there's a question of, are you then shouting through this thing instead of, you know, wearing a surgical mask that's sort of pretty well fitting and you can talk at a normal volume. So I don't know. So things to weigh. So I don't know what the solution is there, but I guess we could do some sort of guidance at least on good mask fitting and things, which I think is a good idea.
Yeah, I do too. I was watching that school committee meeting and several times seeing different principals continue to adjust, you know.
Yeah.
And our, you know, my kids' teachers every day, I see, you know, kind of the common pitfalls of these masks, you know, these fabric masks. So I think some guidance would be good.
Yeah.
I agree. And with it, we should include kind of how many masks I think they should expect to need. Because, you know, you can't use them forever. We've got, you know, a few more months of school left. So we'd have to do that calculation, and then from that you could develop a cost.
Right. It's just an offer too. I mean, I'm not suggesting that we're going to, you know, force teachers to use them, but I think they should be offered them certainly until they're fully vaccinated.
Yep. No, I think that's a great idea.
I don't know if I can put that into, you know, some type of emotion here.
Well, I mean, there is I can say the committee meeting on Monday, so I could bring that suggestion to there's a lot of moving parts, I think, for the reopening or getting more kids in school. So
Kathleen, did you attend that Health and Safety Committee meeting?
I did last week for the first time, yeah. And,
Yeah, was there any updates from that?
I assume, Tim, I can say that they did the pool testing for the first round of teachers. Is that, okay to say? Right?
Yes.
Okay.
I also have some additional stats on that, but.
Oh, okay. All right. So I was told that the first week of testing, they had 435 teachers participate and no positive pools.
And the second week they've had 305 people or 315. It dropped by about 30%.
Yeah. We're seeing with the pool testing in other places too, that, it can be a hard sell for some people. So.
Yeah, it'll be a harder sell after they're vaccinated, but at that point, I don't care as much,
Right,
I mean, even the
right.
state's dropping the guidance on that at this point.
Yeah. So,
Will you be reporting to us
status
when
report?
if we have any teachers that are positive in the pool testing?
What's that?
If the pool testing of the teachers turns positive, will we be notified of that?
I can certainly notify the board after the fact. I don't think it's something that I'm not usually told in real time, nor do I think I really need to be unless there's an in-school exposure. But we can certainly get data on that. Yeah.
Okay, thank you. So Kathleen, you will take the board's guidance and suggest that, you have support of the board to offer that we should be offering some sort of, higher quality mask to the teachers with, proper guidance on fitting.
Yeah. Okay, so I think that's everything. We're 1 minute. So any other points and then we'll close the meeting. All right.
Just one thing. My connection is quite bad, so I'm losing most people. It's freezing quite a bit. Carol did mention, and I can certainly send a copy later this week. The state did come out with some additional guidance from the Department of Elementary and Secondary Education, which I found incredibly unhelpful. Desi continues to make other state departments look good in comparison. And there is also data from DPH about the home vaccination program from the slides that were presented, I think on yesterday or no, the day before, Tuesday, which sort of go into the criteria there. So I can more to look at just so they can understand the sort of that are going to exist for homebound people. They do not really yet exist for homebound people. So if that'd be helpful.
Great.
If anyone's interested in writing I sent this to Tim, a letter to the editor of the New England Journal. You probably all saw Tim's, piece in the Globe. I think, Tim, you sent that to everybody. I certainly support the sentiment there. But what happened in the New England Journal was you have CIC Health. So it's Eric Goralnik and Atul Gawande and one of his colleagues who put together a perspectives piece touting the benefits of mass vaccination sites. And I was thinking of responding to that, not necessarily to say that they're bad, but the diversion of funds has been devastating in a lot of different ways. And, there needs to be an accounting for that as well. So if anyone's interested, let me know, because that has to be done fairly timely.
Yeah.
Okay, Steve, I might be interested.
Okay, thanks, Ed.
Great. All right, so motion to adjourn the meeting.
So moved.
Okay.
Second.
Okay. Christina.
Yes.
Okay. Steve.
Yes.
Rob.
Yes.
Ed.
Yes.
Okay. Kathleen. Yes. Thanks, everyone. I know evenings are hard, but we appreciate it. And we'll see you guys in 2 weeks.
Okay.
Thank you.
All right. Take care.
Thank you.
Thanks, everyone.
Bye-bye.
Bye.
Thank you.